Palpation can be used to find both internal and external structures. So now I'm going to go over some of the surface anatomy landmarks that we learned in class. Okay, so right here in the pink, this is the umbilicus, also known as the belly button. Okay, right over here in the yellow, this is the iliac crest. Okay, and the iliac crest corresponds with L4 and L5 of your lower back, the lumbar spine. Okay, right here in the green, this is the ASIS. This is the anterior superior iliac spine. Okay, this corresponds with S1 and 2 of the sacrum. Okay, and this can basically be found right here. This is the umbilicus. Right here, belly button. Okay, and right over here is the iliac crest, so you can palpate right here, okay, to find it. And then right here, a little bit lower and medially, here is the ASIS, the anterior superior iliac spine. Okay, I am actually an x-ray tech and I use these landmarks every day. For work, for positioning, it's super important, especially those three that I just described right now. I use those to position the patient for pelvis x-rays and lumbar spine x-rays. Okay. So right here in the green, this is the jugular notch. Okay. This is found at the superior border of the manubrium of the sternum. Okay, right here is the sternal angle. All right, and that is where the manubrium and the body of the sternum meet. Okay, so this marks the level of the second pair of costal cartilages. All right, and that right here, so you can find the jugular notch right here. It's like a little dip right here. Okay. And then these blue lines right here and right here. Okay, so those are the midclavicular lines. And these are vertical lines which are located midway between the jugular notch and the acromioclavicular joint. Okay. Alright, so right here, this orange line going down, this is the mid-axillary line. Okay, and this is a coronal line on the torso between the anterior axillary line and the posterior axillary line. Okay. Besides being an x-ray tech, I do perform CAT scans as well. And whenever I am performing a CT of the abdomen and pelvis, I always use this line. I use this line to center the patient correctly on the table. Okay. And then also some other anatomy landmarks. For example, the vertebral prominence, which is C7. You can find that right back here. Okay, it kind of like protrudes outward a little bit. You can just kind of like feel it there. Okay. And basically, this is C7. Your cervical spine is from C1 to C7. Okay, so then the vertebral prominence, this ends the cervical spine, and then that's where your thoracic spine starts. So right beneath C7 would be T1. Okay, some other landmarks are, for example, the temporal mandibular joint, which is right here. Okay. It is also called TMJ. There's also such a thing as TMJ syndrome, which some people do suffer from as well. And you can feel the TMJ right around here. Okay. And you can, if you want to try to find it, you could just open your mouth and close it, and you can feel that right there. You can just palpate that there to find that. Then also the external acoustic meatus, which is right here, your ear. Okay, this is the opening here of the ear. And then also we have the zygomatic arch, okay, also known as a cheekbone. All right, so there are a lot of structures that we can palpate, so that we can visibly see as well. And this can help with underlining structures underneath. Depending on what's going on with the patient, you can palpate certain areas. They might describe that it's painful. For example, if you're feeling their abdominal area, depending on what quadrant it is, then you would know what's underneath it, what organs they are, if it's inflamed or whatnot. So basically all this really helps in the medical field. And I hope you guys enjoyed my presentation. Thank you.